So hi, this is Ahmed Albusoda. I'm a consultant gastroenterologist, so this video is really just to introduce you to the services I provide. This will help you choose the right specialist, but also help you book into the right clinic. So this video is both addressed to patients, but also to our schedulers in our hospitals, just to know exactly what type of patients I see. So general gastroenterologist means someone who treats the digestive tract. However, there are more subspecialties. Some people are more specialized in things like inflammatory bowel disease, which is maybe 80 in a million of the patient every year. But there are people who specialize in more common conditions. So the first subspecialties that I hold, one of the few people in the UK, is Neurogastroenterology. This may sound very niche, but it actually isn't. This is probably more than 50 to 90% of the patients that they go to endoscopy, for example, or they're referred to gastroenterology. So what is neurogastroenterology? These are conditions like pain of the digestive tract. So pain of the digestive tract, feeling sick, vomiting, diarrhea, constipation, things like irritable bowel syndrome, indigestion. So these are the conditions that neurogastroenterologists have more focus on them. Try to understand the core reasons behind them, how you treat them, how you get people better. They may be referred to a general gastroenterologist, which they will probably exclude things like cancers, but actual treatment of those conditions is something that neurogastroenterology focuses on. So the other thing in neurogastroenterology, because you treat what we call functional disorders, and to diagnose them, this is a bit more tricky. That's why neurogastroenterologists are quite skilled physicians in excluding other conditions. So diagnosis of GI disorders, but also treatment of the one that you may go for a gastroscopy, a colonoscopy, a CT scan, and you don't find anything. So that is really what neurogastroenterology does. Now, the second subspecialties that I hold is gastrointestinal physiology. Now, gastrointestinal physiology is how the gastrointestinal tract functions. There are a few conditions that I've done my PhD in the Wingate Institute for Neurogastroenterology, which is probably one of the world's top institute in GI physiology. I've worked with people like Professor Kasim Aziz, Professor Daniel Sifrim. Now, GI physiology, what does that mean really? People with reflux disease, heartburn. Now, we can understand how that functions if you actually have heartburn. If you need things like medications for the rest of your life or surgery, you really need to see a consultant who is specialized in that, just to tell you what is the science in there, what is the evidence, and what is really your best chances. So, gastrointestinal reflux disease, monitoring and diagnosis, swallowing issues. So people with swallowing issues, they may need more specialized gastrointestinal physiology consultants. So these are also things include like, breath tests, SIBO. So these are usually what is gastrointestinal physiology all about. So I am a neurogastroenterologist, but also with subspecialty in GI physiology. The third thing that I specialize in is endoscopy. So I did 1,500 last year. Mainly I focus on screening, gastrointestinal endoscopy, gastroscopies. So sometimes using small cameras to go either through the mouth or the nose with tiny camera to maximize comfort in some people with significant gag reflux. So gastroscopy, colonoscopies, having a look inside your bowel, looking for polyps, or taking them out. The reason people will ask for endoscopy is really abdominal pain, vomiting with blood, nausea, vomiting, for example, bowel pain, significant changes to the bowel, PR bleeding, that is rectal bleeding or bleeding through the back passage with the stools. Those people who need endoscopy. And again, in the UK, all our endoscopies are monitored to see for quality, comfort score, and the time you reach to the end. And I'm happy to share with you all those data just for transparency, which is obviously within the required quality. Now, so that is endoscopy. The fourth subspecialties that I focus on is ultrasound. So ultrasound is something that I always liked, like for example, that machine that stays behind me in my clinic. And this is really using ultrasound to look inside your tummy. So while we talk to you, it depends on the clinic. I have a look inside, looking at your liver, your gallbladder. Is it really the cause of your pain? Assessing things like pancreas sometimes if we can't see it. Looking at the bowel, see if there's any sort of inflammation fluid in the stomach. And that is one of the things that I picked up in Europe, but also did a postgraduate certificate from King's College to be able to basically give you more information from the first time without having to get you back and forth for ultrasound just to tell you the same thing. Now, so this is the fourth part, yeah? So the first part is, the first specialty is neurogastroenterology, second is GI physiology, third is endoscopy, fourth is ultrasound, and fifth that I work on sometimes is also weight management, things like balloon placement for working up for bariatric surgery. And I do work in a group of consultants where we assess group of consultants, dietitians, anesthetists to try to work out the best course, which is, for example, diet only, diet plus medications, balloon, or even bariatric surgeries. So these are the area I focus on. So just to make it easier for the schedulers, which this video is also targeting, anyone with abdominal pain, nausea, vomiting, people who have just been referred by their GP, the most effective way for them to see is someone who's specialized in the 90% of those conditions, which is really the neurogastro: nausea, vomiting, irritable bowel syndrome, diarrhea, reflux disease, heartburn, GI physiology. What I don't necessarily see, and I don't claim to have very deep subspecialties, things like complex inflammatory bowel disease, things like complex Crohn's disease, complex ulcerative colitis, complex liver patients. So those are the patients that I'm not necessarily the best person to see. Of course, I am equipped to diagnose those conditions, but most likely will pass them on into trusted colleagues who spend their time with inflammatory bowel disease. Now, this is unlikely those patients will be just referred or calling you as schedulers to put them into my list. They tend to be already seen, and those conditions are more of a consultant to consultant specialty. So really those are the ones that I don't necessarily see them. But if you are in doubt, you just give us a call, talk to my secretary, use our WhatsApp business, which is monitored. Someone will get back to you and ask, am I the right person to see you? In 90% of the time, it will probably be yes, because it includes those conditions that I have subspecialties rather than just general knowledge in. So just to summarize, neurogastroenterology sounds complex, but it isn't. This is most of the calls you will receive: pain, vomiting, nausea, constipation, diarrhea, reflux, heartburn, indigestion. GI physiology, reflux and difficulty in swallowing, people who need high-resolution manometry, 24 hours reflux monitoring, Bravo capsule. Those are the things that I will be able to help. Third is endoscopy, gastroscopies, colonoscopies, sigmoidoscopies, with significant good comfort score and good detection of cancers, exclusion of bowel cancer, stomach cancer, things like that. Fourth is ultrasound. They tend to be really the patient that I've seen in clinic, not necessarily general referral for ultrasound. And maybe weight management, balloon placement. So thank you very much. If you have any questions, you let me know. I'll give you my contact details. You can get to one of my secretaries and through our WhatsApp business as well, just if you have any questions. Thank you.